So first, there's no safety precautions for the room. So I'm going to enter the room. I'm going to look at the patient's chart. So I'm going to come in. Hi, my name is Kyle. I'm going to be your nursing student for today. Can you please verify your name and date of birth for me, please? Okay, thank you, John. So, can you tell me about any allergies that you have? And then, can you tell me what brings you in today? Okay, so today I'm going to do a head, ears, eyes, nose, and throat assessment on you. I'm going to do a skin assessment, and I'm also going to assess your respiratory system. So first, I'm going to check your vital signs. So I'm going to check your blood pressure, heart rate, pulse oximetry, respiration rate. Okay, so first I'm going to start with your hair. So I'm just going to assess to make sure there's no lesions. I'm going to check the distribution, the color, make sure that I don't see any nits or any other problems, and then I'm going to move down to the face. So first I'm going to check the symmetry of the eyebrows, the eyes, the nose, and mouth, make sure everything's symmetrical, make sure the color's okay, make sure there's no lesions on the face, make sure that all around looks good. So first I'm going to have the patient raise their eyebrows, and then I'm going to have them smile, and then frown, and then I'm going to have the patient close their eyes and touch them with a cotton swab and see if they can feel anything here, if they can feel it here, and if they can feel it here. And then after that, I'm going to start with the eyeballs. So I would I would pull the eyeball down and look at the sclera, the conjunctiva, the iris and the pupil, make sure there's no redness, any inflammation or discharge. I would have them close their eyes, make sure there's no drooping of the eyelid or any inflammation of the eyelid. So I would look directly at the pupil and measure the size of the pupil, make sure that both of the pupils are circular and symmetrical. So first I would begin with a light reflex. So I would just point out my light out here, make sure that there's a sparkle in each of the eyes. And then I would test accommodation. So I bring my pen light and bring it in like this and do that both eyes. And you want both eyes to constrict evenly. And so after that, I would do a smell chart. So that tests their visual acuity. And then we would do a peripheral eye test. So we'd both close our eyes, cover one eye at the same eye. So they would close this eye, and then I would check the peripheral, asking how many fingers I'm holding up. It's 2, and then we move over to the other eye and do the same thing. So they would close this eye and do it again. So after that, I would check the cardinal fields of gaze. So the patient would keep their head straight, and I would move up. I would move one, and they would just follow my finger. And you do all 6 of the cardinal fields of gaze, and then I would let the patient blink and let their eyes take a rest. And then after that, I would make sure I would test their convergence. So I'd hold my finger out and then slowly move it in, and their pupils would go inwards, and you just want to make sure that they react to your finger coming in. And then after the eyes are done, then you move to the nose. So you assess the outer nose. So obviously this patient has a tube on the outside of their nose that goes inwards. Make sure there's no crusting around the eyes. I would take my pen light and look on the inside of the nose and assess to make sure there's no problems with the inside of the nose, make sure there's no discharge. And then the patient would close one nostril and breathe in, and then close the other nostril and breathe in, and that tests their cranial nerve. And then from the nose, we move down to the mouth. So I would look at the outside of the mouth and see if there's any crusting, any lesions, and then we move inside the mouth. So you want to look at their tongue, their gums, teeth, their hard and soft palate. So I would look up right here, and then I would look at the back of the throat and look at the uvula. So I test the cranial nerves for the mouth. So I have them stick out their tongue, move it side to side, and then I would have them stick out their tongue and say ah, and check the uvula in the back to make sure the uvula is moving. And then I would have them swallow.
Hi, how are you doing today?
So then after that, I would move to the ears. So with the ears, you're just going to check the outside of the ear, check the pinna, make sure there's no discharge, check the inside of the ear, make sure there's no problem swelling. I would squeeze the pinna and assess if they had any tenderness or any pain, and I would also squeeze this part, make sure they didn't have any tenderness or pain. To test their vestibular cochlear, I would have them close their eyes and then ask them which ear they could hear. Me rub my fingers together, so do that, and they would just tell me which ear they hear it. And then after I move from the ears, I would move down to the throat. Can't see this patient's throat, but I would palpate the trachea. I would make sure that it's symmetrical, make sure there's no lesions, any bumps. I would test the range of motion, so have them move their head in, back, forth, up, shoulder shrug against resistance, so they would lift up their shoulders against resistance. They would move their head left and right with resistance. And then after that, I would assess the lymph nodes, so pre-oracle, post-oracle, mandibular, submental, and then after that, overall, patient looks good. So we move on. First, I'm just going to do a respiratory and skin assessment. So first I'm going to start with the pulse ox. I need it to be from 94 to 100, and yours is 98, so that's good. So I'm just going to pull your gown down and assess the respiratory expansion. Overall, I'm just going to feel your breaths, make sure that your chest isn't protruding or barrel. So I'd make sure that the width of your chest is twice as long as it is deep, and it is. I don't see any barreling. So first I'm just going to auscultate your lungs. So I'm going to begin up here, and then move across,
I would look at the vertebral line,
move down,
the scapular line.
Move down and across.
So
And
respiratory
if the patient had
and
large breasts, I would just slightly move the breasts to get
no
a better,
further interventions need to be needed. So
better
at this time, I would
auscultation.
just make sure that the bed alarm
I'm
is
going
activated,
to look at
call light is within
the
reach,
landmarks. So
table-side
I
bed
find the
is
sternum,
within reach,
angle of Louis is a protrusion in the chest.
reach.
The xiphoid
That
process.
is in the lowest position and the railings
I would have the
are
patient raise their arm
and
and
then I
look
would ask
at
the patient if they need
the
anything
auxiliary lines.
before
So there's the anterior auxiliary line, the posterior, and the mid-clavicular,
Cool.
mid auxiliary, and then the mid-clavicular
Now we got that out of the way.
is down this way. After I auscultate the front of the chest, I would move to the back. I would give the patient a break before I looked at the back of the lungs. While I'm doing this, I would also just assess the skin. So overall, the temperature is nice and warm. There's no precipitation. They're not clammy, so that's good. I don't see any skin or lesions or wounds. Overall, the skin, I don't see any lesions. I would assess capillary response. Overall, I don't see any issues with that. I would have also looked at hair. I already did that earlier. Overall, their respirations were good. I would make sure that I indicate while auscultating if they had any wheezes, crackles, or rhonchi, or any other issues. I would look at their lips to make sure that they're not pursed, because poor oxygen signs are pursed lips, cyanosis of the lips, clubbed fingers, and flared nostrils because they're trying to breathe in air. Okay, so I'm also going to assess tactile chromitis. So I would just place my hands like so, and then I would just have the patient say 99, and every time the patient spoke, you want to feel vibrations. I would also inspect the breathing, so I would put my hands like so, and my fingers should move together when their lungs expand and move away when they exhale, and I would also do this in the back as well. For my dental inspection, the patient spoke in clear sentences, they were dressed appropriate for the location, they were oriented location, date, and time. I don't see any mental health problems, so I want to indicate for any further examination. So I'd make sure the bed rails are up, call light, I would put their gown back on them. So call light bed rails, bed alarm, make sure it's locked, make sure it can't move. Is there anything else you need before I leave?